Restless leg syndrome refers to a condition where you have usually an uncomfortable or unusual or difficult to describe sensation deep within the limb. Usually the legs is where it'll start out, and the sensations tend to prompt you to want to move your legs to alleviate the sensation. In fact, the symptoms tend to get worse at rest or if you're seated or lying down for a prolonged period of time. And the sensations are such that they prompt you to want to get up and move around because that tends to alleviate these symptoms. Most people who have or develop restless legs syndrome have a family history, probably at least 2/3 of them. Usually, if a person suspects that they have restless leg syndrome, we would recommend that if it's significant enough that it's disrupting their ability to get to sleep or stay asleep, that they talk to their physician about it, and having them review what your symptoms are like, ruling out any other things that might masquerade, neurological conditions or other painful conditions that might masquerade as restless legs syndrome, is what makes the diagnosis. We don't routinely do overnight sleep studies to diagnose this, nor is there any formal or invasive testing or any images or x-rays or anything like that that get done. There are medications available that can reduce the symptoms of restless legs syndrome, and you also want the physician to help look for any other conditions that might worsen restless legs or help or trigger restless leg syndrome. Medications don't cure the problem or affect it in that it still continues to get worse over time as you age, but they do help treat the symptoms to allow you to relax and get to sleep, and they also can reduce leg movements at night and any awakenings from those so that you're not so tired the next day. If people are experiencing symptoms and they think they might have restless leg syndrome, and it has gotten to the point where it is affecting their ability to get to sleep or to relax comfortably in the evening, then they really should consider talking with their doctor, getting an evaluation, seeing if there are other things that may be playing a role in worsening any restless leg symptoms, and also discussing the possible use of medication to help reduce the symptoms.